How's it going, guys? Medium difficulty question for micro for step one. 3-year-old boy, he's got parvovirus B19. Okay, and so it's fifth disease, slap cheek appearance. So not only does it cause this pass level image here, so it's medium difficulty that we have these micro we got to deal with, but not only does it cause slap cheek appearance, but it also can cause aplastic anemia where your RBCs, white blood cells, platelets, all three cell lines are down. It can sometimes cause an isolated pure RBC aplasia where only the RBCs are down. And you need to know that it can cause infection in adults. USMLE is obsessed with daycare workers. They could say 25-year-old woman has a low-grade fever. She works at a daycare center. She's got mild arthritis and has a lacy body rash. That's all they tell you. And then the answer is just check parvovirus B19 IgM titers. So let's just whip to the answer choice here. And the hematologic abnormalities such as aplastic anemia or pure RBC aplasia increase risk in sickle cell. So let's just whip to the answer choices here. Which organism is most similar to parvovirus B19? Choice Acavirus, wrong fucking answer. What you need to know for USMLE, this is the most common cause of viral meningitis, aka aseptic meningitis. So you get a question, stiff neck, photophobia, CSF analysis, elevated lymphocytes, normal glucose, normal or ever so slightly elevated protein. You say, well, that's just going to be viral meningitis. And then I say, well, which virus is most likely to be? And you're like, actually, I have no fucking idea. That's just going to be echovirus. It's an RNA virus. Wrong fucking answer. Choice B, HIV, wrong fucking answer. You could do a lengthy discussion, all sorts of talk about drugs, about different conditions you can acquire. It's an RNA virus. Okay, so it's most similar to HTLV, human T-cell lymphotropic virus, which can cause tropical spastic paraparesis, as well as mycosis fungoides, Sézary syndrome. Long discussion, not going to go down that rabbit hole. HIV, you should know that you commence HAART therapy, highly active antiretroviral therapy at all CD4 counts. And it's going to be 3-drug therapy, not 2-drug therapy. NBME asked that. And then you're going to commence TMPSMX, trimethylsulfamethoxazole, only once you drop below a CD4 count of 200. And that's the prophylaxis for both pneumocystis jirovecii pneumonia as well as toxo. Toxo comes in at a CD4 count of 100. But once you hit 200 and you're on TMPS-MX prophylaxis for pneumocystis, it's 2 birds with 1 stone. You're now covered for toxo when you drop below 100. So what the USMLE likes to do is give you an AIDS patient who's got a CD4 count of, let's say, 50 and has a seizure, and CT of the head shows an irregular ring-enhancing lesion, and they tell you it's a ring-enhancing lesion. You're like, OMG, toxo. But they tell you in the vignette, he or she is on TMPS-MX. You know it can't be toxo because that combo is the prophylaxis for toxo. That's going to be primary CNS lymphoma. There's a lot we can talk about. Wrong fucking answer. Choice C, JC polyomavirus, correct answer. The reason it's the answer is because this is a DNA virus and so is parvovirus B19. It's not dramatic. I could have made this more difficult as far as enveloped, non-enveloped, single-stranded, double-stranded. It's a lot of nonsense. Okay, I've made other clips on this stuff. Can get into more detail regarding some organisms, but in this case, it's just the only DNA virus listed here. Parvo is a DNA virus. Okay, so JC polyomavirus, this can cause PML, progressive multifocal leukoencephalopathy, which is going to be reactivated latent infection in an immunocompromised patient, can cause neurodegeneration over weeks to months. Okay, there's also BK polyomavirus, non-existent for USMLE, but that's going to be the kidney transplant patients. So let's just and also HPV. Okay, so HPV 6 and 11 for condylomatous acuminata, long discussion, 16-18 for squamous cell carcinoma. So JC, BK polyomaviridae, as well as HPV, those are all grouped together in terms of being double-stranded circular non-enveloped DNA viruses. I said I wasn't going to go off into nonsense bullshit, but point is it's the only DNA virus listed here, and so is parvo. Let's just whip to the final ones. Mumps, wrong fucking answer. It's an RNA virus. Okay, so mumps, measles, RSV, paramyxovirus, aka parainfluenza virus. Those are all RNA viruses that are grouped together. RNA viruses that are single-stranded, negative sense, non-segmented, helical nucleocapsid, enveloped. Okay, a lot of bullshit, as I already said. But mumps is going to be POM, P-O-M, parotitis, orchitis, meningitis. Wrong fucking answer. Choice C, rabies, wrong fucking answer. So very rare for USMLE. Okay, you can be knowledgeable of some things like extremely long incubation periods. So bats, okay, skunks, raccoons, rabid dogs. But if once a bite has occurred, it can be many, many months before symptoms manifest. Patients can get hydrophobia, fear of water, aerophobia, fear of air. I know it sounds fucking weird. I don't really know what to tell you. You can get negri bodies. Okay, they're just it's a finding on electron microscopy for rabies. For 2CK stuff, you could be aware of giving vaccine. So immunoglobulin you're going to give if there's been exposure to a rabid animal in an endemic area. Otherwise, you just give the vaccine alone to those who work with the virus in laboratories. But yes, you would give the vaccine if someone's come in the vaccine and the immunoglobulin, both of them, if someone's come in contact with a rabid animal. Point is, wrong fucking answer. Choice F, rubella, wrong fucking answer. So rubella, aka German measles. So this is going to be a head to toe rash, maculopapular rash, similar to regular measles. So measles is aka rubeola, and then rubella is aka German measles. So both rubella and regular measles are going to have a head to toe maculopapular rash. The way you distinguish is rubella, they like to give you post-auricular, which means behind the ears, post-auricular or suboccipital on the back of the head, lymphadenopathy. Okay, so painful. It's painful to palpation, back of the head or behind the ears with rubella. They really, really like that. And measles is going to be Koplik spots. Okay, so whitish, bluish lesions on the buccal mucosa. There's other like rare stuff we can talk about, subacute sclerosing panencephalitis, etc. That's associated with measles. Point is, nonsense, wrong fucking answer. You know the deal. To make more content, if you like my stuff, subscribe my channel. Appreciate your time. That's it.